Hey, good morning. It's Friday. This is Dr. Deb from Medicina del Sol. How y'all doing? Well, we're here for another segment of Feel Good Fridays, and today's topic is osteoporosis. So, I guess what I want to focus on, I want to keep it brief, not too much information, but enough so that you can take it with you and help yourself and others. All right. Osteoporosis is an interesting disease because it is what we call the silent killer. It's a silent disease, and it creeps up on you over time without you really noticing it until something happens. And typically, women are more affected than men. And so it's really important that a good diet and prevention starts in childhood. That's really where it all begins because we want to have good bones. So let me back up. The word osteoporosis, let's break it up. So osteo means bone. Porosis is a condition of being porous. So when you put those two together, you have bone that is porous. And what does that mean? Well, it means that the bone has weakened the matrix inside the bone. So you have cortical bone on the outside, which is the hard outside of the bone. But on the inside, there's a matrix, and there's like a meshwork of soft bone. And so that's a very dynamic system. A lot of blood moving in and out of that, nutrients, minerals. And so over time, if you're not you don't have enough calcium in your diet, you don't have a number of things going on to support that bone, then it becomes weakened and porous. And first it starts with what we call osteopenia. And so osteopenia, again, we're taking the word osteo, which means bone, penia, which means little, or what we call breaking down of the bone. Sorry, I'm sitting on a ball for active sitting, just in case you're wondering. And so osteopenia is the shrinking of the bone, where it becomes weakened. So that's the prelude to the osteoporosis. You're going to first be diagnosed with osteopenia, and sometimes we don't even know when we have osteopenia until you develop things like fractures. All right. So it's really important to take a step back and look at lifestyle. That's huge. And we can do a lot to change it, a lot to prevent osteoporosis from happening. There are certain things that predispose people to osteoporosis, and I'm going to get into that in a minute. But really, osteoporosis is more of a concern for women that are closer to the age 50 plus, because now hormones are changing, and there are a number of things that just that change at that point in time. And so I'm going to, again, go into that a little bit more, but estrogen is the big one. So we like to screen women age 50 plus, and especially after menopause, for the weakening of bones, osteoporosis. So what are some of the factors that really you can't control with osteoporosis? Well, your age. Everybody ages, unfortunately. It's just one of those curses in life, but we can do a lot to move into our later years in a more healthy way. And so you can modify your diet, but again, age is something that is inevitable. So when women especially reach the age of 50, we need to be more aware of what we're doing, what we're putting in our bodies, what we're doing to our bodies in terms of preventing osteoporosis. Women, yeah, women are more susceptible to osteoporosis than men. It's just a fact. You may have a family history of osteoporosis, and so that's always something to consider. When we screen patients, we always find out about their family history. That's a very important part of the interview process, because genetics plays a huge role in disease and how certain individuals may manifest or develop certain conditions over time. So If you are menopausal, meaning you have stopped menstruating and you're at that point now where hormone levels have changed, you are definitely more susceptible to developing osteoporosis. And if you've had a hysterectomy, if ovaries have been removed, that's huge because those are vital organs for women's hormones, estrogen, and the whole cascade of hormones that play into bone health. So those are some of the things that you may not necessarily be able to change. Another thing that you may not be able to change are medications that you're on. If you have heartburn or gastroesophageal reflux disorder, where you have burning sensation, a lot of acid production, or you may have an ulcer and you're taking what we call a proton pump inhibitor, aka Nexium, omeprazole, something like that, that does predispose you to osteoporosis. Just be aware of that if you haven't been told. Certain antidepressants, SSRIs, medication for anxiety can also predispose you. Steroids, huge. And this is something you may not be able to change. This is something you may not be able to get off of because it is really important for you to stay on a glucocorticosteroid to manage your condition, whether you have a chronic inflammatory joint disease like rheumatoid arthritis, or if you have psoriasis. I mean, some of these steroids are really important for you to just be functional every day. But we need to be very vigilant and very aware of its effect on your bone health. So as healthcare providers, we need to check this status over time. What else? Chemotherapy agents can also play a huge role in bone health. Not in a good way. So, but again, is that something you can change? If you're on a chemotherapy drug because you're trying to save your life, you're not going to go off of it, right? You're fighting the good fight. Unfortunately, we just need to be aware of what it could do to other organs in the body, i.e. the bones. So we stay on top of that. Thyroid hormones can also do this. And again, the thyroid's really important for a lot of things in the body. So if you're on levothyroxine or thyroid medication, you may need to just check your bone density every so often. Let's see, certain conditions, medical conditions that predispose you, like I mentioned, rheumatoid arthritis, COPD, chronic obstructive pulmonary disease, asthma, diabetes. Diabetes is one of those conditions that just affects so many things in the body. And it's super important if you can prevent it and you can manage your diabetes or even reverse it, all the better. So it's really important for you to stay on top of that. And amenorrhea for women, and I'm going to give you a little story about me. In my college days, early on, when I was getting my exercise physiology, exercise science degree back in the day, I was very involved with athletics. I was teaching fitness classes, doing triathlons, duathlons, marathons. I was super active, and it was great. I loved it. But the problem is that I wasn't eating probably well enough to support that, and I stopped menstruating. And so when that happens, there's a huge shift in the female body and that system. And now your hormone levels change, and that's when the bones are put at risk of becoming porous. So I was actually involved with a nationwide study at the time for athletic females in college. And I had 2 bone density scans done. I'm going to get into that in a minute. But it turns out that I had lost, get this, 25% of my bone density. And I was only 21. That's huge. And that's very unacceptable for someone at that age. So I had to make a change. They sat me down and we talked about options. I was in college full time. I was working on the side. I was doing all this athletic activity, and I found that I reached this impasse. I had to make a decision. Am I going to take care of myself and live, or am I going to continue on the road of being athletic, going to school, doing what I was doing, and getting progressively worse and eventually developing fractures? Well, I had to take time off school, get myself back on track, and I was able to bring my bone density back to 100%. How did I do it? Well, I'm going to get into that. Okay, so I'm going to just continue. Things that you can change, things that are within your power to keep your bones strong. All right, if you drink alcohol excessively, now I'm going to just make this point that if you drink alcohol once in a while, that's fine, it's allowed. But if you're drinking, let's say for women, the recommendation is 1 to 2 per day max. Okay, and now they're saying, the new studies state that maybe that's not even a good thing. None is better. But anyways, if you have 3 or more glasses of a beverage, an alcoholic beverage per day, you are putting yourself at risk. Just saying. So you may want to curb that a little bit if you're concerned about your bone health. Smoking. What can I say? Smoking is one of those habits that is really, really hard to kick. It's super hard, I'm telling you. And I'm telling you from experience, because back in the day when I was young and silly, I smoked for a while. I was not addicted, but I know how difficult it is because it becomes a habit. It became a habit for me. I wasn't addicted to the nicotine, but once I went cold turkey, I was able to do that. Not everyone can, but it totally changed my health completely. I had fewer illnesses. I felt better. I had more energy. My skin looked better. My muscles responded better. Things just function better when you don't smoke. Keep that in mind. And so if you're trying to preserve your bone mass, quit smoking. Your low, so body mass index. I don't know if everybody knows their body mass index, but it's your weight and your height that we take into consideration. So if you have a body mass index, and these are according to the standard set, 19 or less, you are very low weight for your height and you are at high risk of osteoporosis. Poor nutrition. Are you drinking enough milk? Now, some people are lactose intolerant, like myself. So, I drink milk with lactate or lactase. It's the enzyme that you need to break down lactose. And so I have that daily, but I also take a supplement. It's tough. Taking a supplement is not always everybody's thing. Taking pills, if you already take a lot of pills, it's, just an additional pill. But it could be a life-saving pill. So it's really important to consider that. And if you don't want to take a supplement, then look at your food. Look at the food that you're eating. Is it high in calcium? Kale is a great green leafy vegetable that is high in calcium. There are so many. If you Google it, you'll see the list of all the high calcium foods that you can add to your diet. I highly recommend it, not only because that's a great way to get your calcium, but all the other minerals and enzymes that are in that food, they work synergistically and make that calcium more bioavailable for you to use rather than just taking a supplement. Vitamin D, very important for bone health. It all works into the whole process of bone renewal and calcium, phosphorus. It's one of those vital components that a lot of people are lacking. And here in this part of the world where we get a lot of sun, that's great because we manufacture vitamin D with sun on our skin. But sometimes you may not have the ability to really produce enough of the vitamin D that you need. So as we get older, it may be warranted to add a vitamin D supplement. But bear in mind, you don't want to overdose on vitamin D because it's a fat-soluble vitamin. And what does that mean? It means that when you take an excessive amount in, your body doesn't just spit it out, it stores it for a while. So there's a happy medium there. Really, it's probably best, if you're concerned about your vitamin D level, ask your provider to check your level. It's easy. And then you have a better idea. Eating disorders. Yes, eating disorders like anorexia nervosa, where you severely restrict your food intake for a variety of reasons, that can certainly put you at high risk because now you're nutrient deficient in your diet. And when you get into that whole process, and it can go on for years, decades sometimes, it really puts you at high risk of losing bone mass. So if you have an eating disorder or you know someone who has an eating disorder, please get them help because they can change their life. They can recover from that. But it's really important to have that addressed and diagnosed properly. Inactivity, sedentary lifestyle. These are all things that you can change. So sedentary lifestyle is where you don't move a lot, quite simply. You're sitting, let's say you have a 9-to-5 job Monday to Friday, and you're sitting at a desk and you rarely get up to move around and activate your muscles. Well, what does activity do to bone? How is that important? Well, muscle is attached to bone with tendons. And so when you activate your muscles and you move, you're ambulating and you're exercising, you stimulate the matrix of the bone. You stimulate the blood flow going to the bone. And that is super important for keeping the bone healthy. So if you don't do a lot of exercise or if any, then you're not stimulating the bone the way you should be. I'm just checking my cheat notes, just so you know. So anyways, vitamin D we mentioned, calcium, really important, and you can add that in a variety of ways. Okay, so let's talk about testing. How do you test? How do you know if you have osteoporosis or you're moving towards osteoporosis and you're maybe in the osteopenia stage? Well, have a sit-down discussion with your provider and talk about lifestyle and maybe familial or the history in your family. And if it's warranted, then you will probably be scheduled for what we call a DEXA scan, where they scan the bones, and they may do just the femoral, the hip, the femoral neck, or they may do the shoulder, they may do the neck, and they will get an assessment. Sometimes they do the ankle. That's another one too. Anyways, they can do a scan to ascertain the level of bone mass or bone density. And so if you have a T-score of -1 or better, then you're fine. You're normal. It's when those numbers change and they go more negative, -2, and so forth, that is more of a concern, and then you probably need to have some treatment. So really important to have that awareness. How do you know if you should get tested, right? Well, if you have had spontaneous fractures, or if you had a very soft fall and fractured something, that's a big red flag for us, because that shouldn't happen. If you have a fall or you stumble or you end up falling against a wall and you fracture something, your bones should be able to withstand that force. So if there's a low mechanical force that causes a break in the bone, we wonder what is behind that. So that's usually a reason to get a DEXA scan. Again, women who are amenorrheic, who have no period, no menstrual cycle, definitely need to be monitored closely. If you're 65 plus, you're postmenopausal, you need to have close monitoring and just make sure that your bone mass is dense. So there's an assessment tool called a FRAX. This is a fracture risk assessment tool. And we use this clinically to determine if we need to treat or how we need to manage a patient, what their risk is going forward, 10 years, their risk of developing fractures. And the worst fracture, I think, that really sets people back severely is a hip fracture. And often for women that are postmenopausal, they may have a significant fall, or they may have a fall just getting out of bed. And we get them into the emergency room, we scan them, we do an image, and we see that there is a fracture of the femur, usually the hip, the femoral neck. And that can really be difficult to recover from at that age. So that's how most find out about I shouldn't say most, but a lot of women will find out that they have osteoporosis based on that outcome, that fracture that was found as a result of just a minor fall. And so that's a difficult place to be for family and for the patient, because recovery is pretty difficult. So it's really important to try and prevent all of that from happening. And sometimes you can't, and we just have to do the best we can to manage it. But if you can change your diet, change your lifestyle, you can prevent some of those dire outcomes. All right, what else? I mentioned the T-score for bone density, and I've talked about prevention and management. Weight-bearing activity, people. This is so important, and I stress this to all my patients, my female patients especially, because when you do weight-bearing activity, i.e. lifting weights, or even doing a good hike, going uphill, you're stressing those muscles, and when you stress the muscles, you stress the bone in a good way, and that helps to increase the matrix, increase blood flow. It stimulates growth, and that's what we want. We want to keep those bones healthy. So any kind of activity that utilizes gravity, your body working against gravity, like lifting weights, is going to be the best medicine. I don't care if you're on medications, you've been taking calcium and vitamin D for years. No, you need activity. You really do. I get really, really excited about this because I personally, and I'm going back to my story, I personally brought my bone density back up to 100% by weight-bearing activity and eating better. But the weight-bearing activity was what really made the difference. And it's within our power. We can do it. We just need to set aside time, get a routine in place, and start lifting weights or start exercising. So if you don't want to go out and buy hand weights and you just want to start doing some exercises in your home, use soup cans. You can do that. There are a lot of things you can makeshift at home to give you that resistance that you're looking for. Dynabands or elastic bands are great for exercising the muscles and the bones. So, if you have any questions about how to do this or how to start, give us a call. Give me a call, Dr. Deb, at 575-222-1834, or go on Medicina DPC, and you can send me a message, or you can just call me, you can email me, whatever you want to do. But I would love to hear from you if you have any questions about this. There are a number of medications that you can take for osteoporosis once you have been diagnosed, but I'm focusing more on prevention today. And the medications are great. I mean, they work well, but there are a lot of side effects to it. And if you can avoid going on them, that would be best. But you know what? If it's going to prevent fractures and it's going to save your life, you need those medications. So, but try to do whatever you can to avoid taking them. Okay? Drink less alcohol, quit smoking, or try to quit smoking. It's not easy, I know, but just lessen the amount of cigarettes that you have daily. Diet rich in calcium and vitamin D, weight-bearing activity, and just stay on top of things. Be happy. And I know it's tough right now, but try to be proactive with your health. Don't wait until things happen. Try to think about how you can prevent these dire outcomes and do what you can today. Don't put it off until tomorrow. If you're all interested in a osteoporosis risk assessment that you can do online, I'm going to post that after. So you can click on the link and go to the survey or go to the questionnaire, and it should give you your results after. And then you have a semblance of an idea of where you're at with that and go from there. All right. Well, that's the segment for this week. I'm not sure what I'm going to do next week, but I invite everyone to send me a little text, send me a message, say, hey, let's talk about whatever. That would be great. I will certainly do that. I will delve into it and give you all the juicy stuff you need to know. All right, I want you all to have a great weekend and stay safe, be well, and we'll catch you next week. God bless. Peace out.